Nipah virus kills in Bangladesh. Should Pakistan be worried? Greetings everyone. Welcome back to ISN Global. We have seen that World Health Organization confirmed that a woman has died from Nipah virus in Bangladesh. This comes just days after India reported 2 confirmed cases in West Bengal. Nipah is not COVID. It doesn't spread as easily, but it kills up to 75% of the people it infects. There is no vaccine and there is no cure for that. Pakistan has already declared an emergency at its airports and tightened the border screening. Fruit bats that carried the virus are found in Pakistan, northern and rural regions as well. So, what is Nipah? How worried should we actually be? And what does this mean for Pakistan? I'll explain you in the next 5 minutes. Keep watching. So, Nipah virus was first identified in 1998 during an outbreak among pig farmers in Malaysia and Singapore. It's a zoonotic virus, meaning it jumps from animals to humans. And a natural host is fruit bats from Patorpus species, commonly known as flying foxes. These bats carry the virus without getting sick themselves, but they can pass it to humans and other animals. Now, it spreads through the contaminated food, especially raw date palm sap. Bats feed on the sap overnight and leave behind saliva carrying the virus. People who drink it, they can get affected. It can be through direct contact, infected animals, especially pigs and bats, or it can be through person-to-person transmission via closely contact with bodily fluids of an affected person, particularly in hospital or caregiving settings. Now, the symptoms, they start like a bad flu, fever, headache, muscle pain, vomiting, but it can spread progressively to severe brain swelling, which can cause disorientation, convulsions, coma, and frequently death. The fatality rate is devastating, 40 to 75% depending on the outbreak. For comparison, if we look at COVID-19 fatality rate, that was around 1 to 2%, but Nipah is far more lethal per infection. And here's the critical point. There is currently no approved vaccine for that, no specific antiviral treatment. Now, management is entirely on supportive treatment of symptoms, hoping that patient's body can fight it off. So WHO, they classify Nipah as a priority pathogen because its potential to spark fast-moving outbreaks is extremely high, is the death rate that it causes. So what's happening right now? WHO confirmed that a woman aged between 40 to 50 in Nowgaon district of Bangladesh, Rajshahi division, she died on January 28 after contracting to Nipah. Now, she had been drinking raw palm date sap between January 5 to 20. She developed fever, headache, and muscle cramp on January 21, which rapidly got worsened. Hypersalivation, disorientation happened, and by January 27, she was unconscious and she died after a day being admitted to hospital. 35 people who had contact with her have been identified negative, so currently no further case have been detected so far. Now, Bangladesh is not new to Nipah. Since 2001, the country has recorded 348 cases, 250 deaths, and a case fatality rate of 72%. Nearly half of those cases were linked to drinking raw palm date sap, and 2025 alone, 4 people died from virus in Bangladesh. In India, just before Bangladesh's death, India confirmed 2 Nipah cases in West Bengal in early January 2026, and reportedly they involved healthcare workers. Now, all 196 identified contacts have been tested negative so far. India has experienced 9 Nipah outbreaks since 2018. Most of them were in Kerala state, but this is the first one in West Bengal state. The India case triggered alarms across Asia because multiple countries, including Pakistan, Malaysia, Thailand, Indonesia, Singapore, Vietnam, Nepal, Hong Kong, they have immediately stepped up airport screenings. Now, what does this mean for Pakistan? Pakistan has never recorded a confirmed case of Nipah in humans, but experts say that risk cannot be overruled. Here's why. Because bats are here, fruit bats of the Patorpus species specifically, they have natural reservoirs in Pakistan, particularly in northern areas, forested regions, and ecological conditions that enable Nipah spillover in Bangladesh, India, they exist in Pakistan as well. Now, Pakistan, we also share border with India. We have significant travel and trade connections with Bangladesh. That can be cause of spread because the cross-border movement, it increases the risk of transmission, especially given that Nipah has an incubation period of 4 to 21 days, meaning an infected person could travel without showing symptoms. So, Pakistan's healthcare system, they face challenges that could make Nipah outbreak difficult to contain. We have limited diagnostic laboratories, we have delayed detection in rural areas, and hospitals, they often lack proper isolation wards. It all increases the risk of human to human transmission, and especially among healthcare workers, which is exactly how Nipah has spread in previous outbreaks as well. Now, the federal government, they has declared an emergency at all airports. They have tightened surveillance at the entry points, and the border health services, they have ordered 100% screening of all arriving passengers, transit passengers, crew members, and support staff. Now, it's important to know that National Institute of Health, they held a high-level meeting and confirmed that Pakistan has adequate laboratory capacity, diagnostic kits to test suspected cases. Dr. Rana Safdar, a leading infectious disease expert, he told to Dawn that principle of infectious disease respect no boundaries, it helps. But risks to Pakistan, they are moderate to low based on the current situation. And he said that there is no reason to panic for people. Now, should we actually be worried? The fatality rate of 40 to 75%, one of the highest of any non-virus, is there. No vaccine, no cure. Several candidates are in development, but none of them are approved. So it can spread person to person, especially in healthcare settings. Globally, 750 confirmed infections and 415 deaths have been recorded since 1998. And Nipah, it does not spread easily through the air like COVID-19 virus or influenza. Its outbreaks have historically been small, localized, and they contained quickly. Like Bangladesh report, fewer than 10 cases most years. So the honest answer would be that Nipah is not going to cause a lockdown or any pandemic in the current form, but it is a virus that scientists watch very carefully. Because if it were to mutate and become easily transmissible between humans, the consequences could be catastrophic. So, for Pakistan, the right response is exactly what's happening right now: vigilance, screening, preparedness, and not panic. So, what you should know if you're in Pakistan or you're traveling across South Asia, here's what health authorities recommend to you. Do not drink raw or partially fermented date palm sap. If consume date palm sap juice, make sure you have boiled it first. And wash and peel all the fruits thoroughly before eating. Avoid contact with bats, pigs, or any sick animals. Practice good hand hygiene, especially in hospital settings. And if you develop any sudden fever with headache, confusion, or breathing difficulty, especially after traveling from an affected areas, please seek medical attention immediately and inform the doctors of your travel history. Now, Nipah virus, we can say it's not a pandemic, but it is a deadly reminder that zoonotic diseases, means viruses that jump from animals to humans, they remain one of the highest threats to global health system. Now, the situation here is contained for now, but in a connected world where preparedness is not an optional, we should prepare. What do you guys think? Pakistan is doing enough or not? Share your thoughts in the comments, subscribe, and keep watching ISN Global.